If you have a history of dementia in your family and fear you may develop memory issues too, this brief video should help. We will discuss the risk of dementia and suggest how you can learn what to do to reduce or eliminate your chances. There are 3 basic forms of cognitive decline associated with aging. Age-related changes in memory that is a natural consequence of aging. Mild cognitive impairment involves mild memory loss such as forgetting important events or appointments, or an inability or difficulty with finding the right word in a conversation. Dementia, which includes Alzheimer's disease, is a chronic, progressive, irreversible, and comprehensive cognitive impairment that may affect daily functioning. Mild cognitive impairment is an intermediate stage between the expected cognitive decline of normal aging and the more serious decline of dementia. It can involve problems with memory, language, thinking, and judgment that are greater than normal age-related changes. There is mounting evidence a sizable portion of individuals 70 years of age and older likely have cognitive impairment without dementia, which affects not only their ability to carry out activities of daily living, but also to continue living independently. An estimated 22% of adults over 71 years of age have significant cognitive impairment without dementia. Approximately 36 million people globally are living with dementia, and the average likelihood of dementia being diagnosed in a patient doubles every 5 years after the age of 65. If you have mild cognitive impairment, you may be aware that your memory or mental function has slipped. Your family and close friends may also notice a change. But generally, these changes aren't severe enough to significantly interfere with your day-to-day life and usual activities. Your brain, like the rest of your body, changes as you grow older. Many people notice gradually increasing forgetfulness as they age. Mild cognitive impairment may be indicated if you experience any of the following. You forget things more often. It may take longer to think of a word or to recall a person's name. You forget important events such as appointments or social engagements. You lose your train of thought or the thread of a conversation as you are reading a book or watching a movie. You feel increasingly overwhelmed by making decisions, planning steps to accomplish a task, or interpreting instructions. You start to have trouble finding your way around familiar environments. You become more impulsive or show increasingly poor judgment. Your family and friends notice any of these changes. There are a range of risk factors that can lead to cognitive decline, including increased age, genetic predisposition, smoking, excessive use of alcohol, physical and mental inactivity, chronic stress, medical conditions such as diabetes, depression, high blood pressure, high cholesterol, and hardening of the arteries. And finally, low social involvement. The single most important predictor of cognitive decline is age. Evidence also shows that nutrition can also play a significant role in the reduction of cognitive decline. The roles of the B vitamins, specifically vitamin B12 and folate, in cognitive function and decline have been extensively studied. The fatty acids DHA and EPA are important constituents in the brain and may affect cognition. Vitamin D has several health functions beyond bone health, including roles that are central to cognition. Low vitamin D levels point to increased rates of cognitive decline and increased risk of dementia. Folate, or folic acid, is important in the nervous system at all ages, but in elderly people, deficiency contributes to aging brain processes and increases the risk of Alzheimer's disease. In a survey of nutritional status and cognitive functioning in healthy elderly subjects aged 60 to 94, there was a significant relationship between impaired abstract thinking and memory and lower folic acid levels. In the New Mexico Aging Process study of people 66 to 90 years, associations were found between measures of abstract thinking and concentrations of folic acid, as well as other B vitamins. It has been shown that supplementing with nutrients your body doesn't produce in sufficient quantities anymore, or are not present in your diet, can increase mental acuity and ward off cognitive decline. A quality brain supplement should include high quantities of the B vitamins, especially vitamin B12, vitamin D, DHA and EPA, and folic acid. Green Planet Nutraceuticals has an excellent brain formula product. It's manufactured in the USA in an FDA-approved facility using the highest quality natural ingredients. It is packed with high amounts of the essential vitamins shown to improve cognitive ability, including the B vitamins, vitamin D, DHA, EPA, and folic acid. But the bulk of the formulation is a proprietary formula consisting of many other nutrients shown to positively affect brain health. Here are a few. Vitamin B7, more commonly known as biotin, is a water-soluble nutrient that is part of the B vitamin family. Without biotin as a cofactor, many enzymes do not work properly, and serious complications can occur, including various diseases of the skin, intestinal tract, and nervous system. DMAE is a compound in fish, increasingly favored by medical practitioners for its role in boosting brain power. DMAE has shown positive results in the treatment of a variety of cognitive disorders, including attention deficit disorder and memory lapses. DMAE increases the brain's production of acetylcholine, which affects functions such as short-term memory, learning, and attention. Bacopa is a commonly used nootropic, traditionally used in Indian medicine. The powerful herb increases brain chemicals involved in learning, memory recall, and other cognitive processes. DHA is the active component in fish. DHA is also required for maintenance of normal brain function in adults. The inclusion of plentiful DHA in the diet improves learning ability, whereas deficiency of DHA are associated with deficits in learning. Decreases in DHA in the brain are associated with cognitive decline during aging. Evidence suggests that adequate DHA intake may help prevent age-related memory decline and Alzheimer's disease. Bilberry has been used for centuries, both medicinally and as a food in jams and pies. Bilberry fruit contains chemicals known as anthrocyanosides, plant pigments that have excellent antioxidant properties. Studies suggest anthrocyanosides may help lower the risk of chronic diseases including cancer and Alzheimer's disease. L-glutamine is the most abundant amino acid in the bloodstream. It's an essential neurotransmitter in the brain and helps with memory, focus, and concentration. L-glutamine is believed to remove metabolic residue in the brain, acting as a detoxifier and improving brain function. The stimulating effects of L-glutamine help increase energy and attention, making learning and cognitive function easier. Phosphatidylserine helps the brain communicate between cells and complete many other crucial functions. Phosphatidylserine has been found effective in treating attention deficit disorder, Alzheimer's disease, memory loss, stress, and depression. Oftentimes, phosphatidylserine is used to help with focus, memory recall, attention, and concentration. Huperzira serrata is a type of fur moss that contains the memory-boosting nootropic compound hyperzine A. This acetylcholine inhibitor is known for increasing levels of a neurotransmitter related to memory formation, recall, and many of the most basic cognitive functions. It enhances learning and has been shown to improve age-related memory loss. The plant itself is also known as Chinese club moss and is native to India and Southeast Asia. The extract of this plant has been used in the traditional medicine of China for centuries. Vinposidine is a powerful brain health ingredient that increases oxygen and blood flow to the brain. This ingredient is often used to prevent Alzheimer's disease and memory loss due to aging. Choline is often used to treat Alzheimer's disease, memory loss, depression, and other psychological disorders. Many people who have a history of dementia in their family and fear they may develop memory issues too have improved their mental focus and allayed their fears by supplementing their diet with Green Planet Nutraceuticals' proprietary brain health formula. You can try it for yourself by going to our Amazon.com listing. You'll want to take it for at least 30 days to give it a chance to work. You actually can try this risk-free, because if it doesn't work for you, we'll give you your money back. Click the link in this video or in the description below to go to our Amazon.com listing.